Dr. Mila McManus, I'm just so thrilled to have you back. You were on my last summit, and we've gone on to continue to get to know each other. And you are so brilliant in your space. I'm so grateful to know you and have you on again. Can't wait for this topic. But first, let me talk a little bit about you. I know you graduated at the top of your class from the University of Texas Houston Medical School in 2000. You're a board certified family medical physician. You quickly figured out that allopathic and conventional medical model was not your jam. So you wanted to get to the root cause of things, not just treat the symptoms. So in 2004, you founded the Woodlands Institute for Health and Wellness. You have many certifications in specialties. You've been featured on TV, radio shows, podcasts. You've offered the book Highway to Health, a nutritional roadmap. I know that's a huge area of interest to you, where you're able to really move the needle for your patients. You were voted best doctor by your community every year for 13 years since the local competition started. And I can say personally, I have met two people who work with you, and both of them just sing your praises. They've both been with you for decades, or I don't know how long, but long time since the beginning. And they both speak so highly about you, which I find amazing. In 2023, you also won the Living Magazine's Reader's Choice Awards in two categories, including the Best Functional Medicine Doctor. You're kind of a big deal in your area. And actually, even since I saw you last, I've even talked to some other people that live in the area that just happen to know who you are just because your name is so big in that area. So I have the privilege of getting to know you. I know the topic that we're going to be talking about today, I think, is going to be so huge for people because it's fundamental stuff. You work in the anti-aging and longevity space. You offer so many things in your office to help people, but we're going to go back to the foundation. We're going to talk about what are some of the most common labs that both allopathic and functional medical doctors may order, and what patients should know, and why does it matter? Because these labs are the basics for a reason, because they're what keep people healthy and alive, and moving that, expanding their lifespan and their health span, right?
Absolutely. And thank you for such a wonderful introduction. And thank you for having me on your summit again.
Awesome. I'm so excited. So I want you to start with um, just talking about, we know that reference ranges on labs are not set in stone, right? They're not the perfect answer to the question, are you normal, so to speak? So how are they established, and why is it a flawed system?
Yeah, maybe we call it 50 shades of gray in the lab interpretation world. So there are big flaws that in the way that reference ranges for labs are. So if you're out there looking at your lab report and you see a reference range is 1 to 100, well, that's a pretty big spread for any lab. And so the way that labs are established is they take a particular number of people that hopefully would be in the hundreds of thousands, but I have found that to not be the case over the years after talking to some labs. One worker at a lab years ago told me that the way they created their own reference ranges is they just tested the 20 or 50 or so people who worked in the lab, and that's how they got their bell curve. Like, that's not real scientific, is it? So you want to have a huge number of people to test for, but they're taking what's seemingly healthy people and they're testing, let's say, their thyroid level. And the normal reference range is 0.5 to 4.5 for a TSH level, which is the basic test that most doctors will test for. Well, what they do is, how they arrive at that is from testing all these people's thyroid levels, they create a bell curve and then they get the average, which is the peak of the bell curve, and then they go out 2 standard deviations. And so that's how they arrive at 0.5 to 4.5, for example, on a TSH level. Well, okay, that's all good for a population, but everybody is an N of 1. Okay, we're all different, we're all unique. And why would somebody have a TSH of 0.5 and other people have a TSH of 1 and 2 and 3 and 4 and 4.5? I wonder how those people really feel when they're up there in the 4.5 range. So just because somebody's TSH level may be in normal range, it may not be your normal. And so that's when symptoms can be very helpful to tease apart, listening to the patient and putting that puzzle together of, you've got these cluster of symptoms that scream you've got a thyroid problem, or yeah, this sounds like you're anemic, and maybe you're just slightly above the normal range on your blood counts, and so you're not technically anemic, but maybe that's not really your normal. And so there's big difference there between normal and optimal.
Yeah, that's such a good point. I remember a little while back, one of my friends was asking me, like, why is my white count always so low? But it was like low normal, and everyone would be like, hey, it's normal. And I like, yeah, but you're sick all the time, right? So obviously there's an issue there. And,
Mm-hmm.
doctors are traditionally trained doctors, allopathic, are taught, hey, if it's in normal range, then that's not your problem, whatever it is, right?
Mm-hmm. And with that number of patients you have to see in a day under managed care,
Yeah.
doctors don't even really stop to look at anything that's not flagged as abnormal.
Right. Anything that's red or has a star next to it or however it is and it's interesting that these reference ranges, they change over the years and they change based on the lab that you're ordering it from. So now I know that we're going to be talking a lot about blood work to educate the general public about how to look at their blood work, but you also want to acknowledge blood work doesn't give all the answers, right?
True. Again, it goes back to looking at symptoms and talking to the patient to find out what your actual symptoms are. And a big one for me is other hormones, not just thyroid, which I already talked about, but when it comes to, checking an estrogen level or a progesterone level on your blood tests are not generally helpful for me. Those fluctuate all the time, and it depends on where you are in your cycle, if you're not menopausal or postmenopausal at that point. But symptoms will give me such a beautiful picture of what's going on in terms of hormonal imbalances and what we need to do about that. So if a woman comes in with what we call estrogen dominant symptoms, and estrogen dominant could be that the woman has a normal progesterone level and excess estrogen, or it could be that she has a deficiency of progesterone and a normal estrogen level. So we just call that estrogen dominance. And so symptoms of estrogen dominance are PMS is a big one. So if a woman has premenstrual issues like breast tenderness and mood swings and fluid retention, headaches before her periods, that's a really good indicator of estrogen dominance. I don't need to see a blood level of estrogen and progesterone to know that. And another reason why you have to think outside the box and not just look at your estrogen level is think of all the thousands of toxins that are in our environment. And a lot of them are called xenoestrogens, which means they act like estrogen in the body. So you could have a perfectly low or normal estrogen level, but be estrogen dominant because of how toxic you are. Or you might have a liver problem that doesn't even show up on a blood test. Maybe your liver enzymes still look normal, but your liver's not functioning optimally, so you're not clearing out estrogens as well. You might have nutritional deficiencies that are affecting your ability to clear out hormones and stay balanced in the body.
Yeah, and there's a bunch of phytoestrogens and other kinds of estrogens out there that are contributing to that. Why does it matter if a woman is estrogen dominant? If women are supposed to have estrogen, that's what we're taught, right?
Yeah, but it's really about you needing to be balanced. I mean, number one, it's not good because you're going to have symptoms of it when you're estrogen dominant. It increases your risk for breast cancer. But it'll can affect your weight, ability to maintain your weight, cause like just swelling in the body, a lot of headaches, and then like the PMS, breast tenderness, excessive growth of breast tissue in general. It can cause abnormalities with your periods. It can create other gynecological issues like fibroids and such. And so it's really, you want to make sure you're balanced with estrogen is really what it's about. And that can really help with, so if a woman's estrogen dominant and I give her some progesterone, some real bioidentical progesterone cream, that can just take care of a lot of problems. But we don't always have to go there. It depends on the severity of their symptoms and how old the person is. A 22-year-old's a lot more resilient than a 42-year-old. So a 22-year-old, if I could just clean up her diet and help support her detox pathways, then, she doesn't need hormones. She just needs to clean up her act.
Yeah. So when is it a good time that you may want to order hormonal labs specific to females? When would that be helpful?
Well, if I do start someone on hormones, then we're going to want to test those levels periodically. And my test of choice is usually saliva testing, because we most often use hormones in cream form. There's a lot of different ways to get hormones in your body. And I am very partial to the cream topical forms of hormones or patches, as long as it's a bioidentical patch, that you're bypassing what's called the first pass metabolism. And so when you take anything orally, it gets absorbed, it goes straight to your liver, metabolizes out most of it before that substance even gets to where it needs to go. So when you take oral hormones, you got to take a lot higher doses. When you're using topical forms, it bypasses that first pass metabolism. You can use much lower doses. And in a cream form, we can adjust that dose and fine tune it to the woman's symptoms as well. So we can just increase it a smidge or decrease it a smidge based on how the patient's doing. And then with needing to monitor it just to make sure that they're in the right balance, because they may feel great, but they might, some women will depot up the hormones. They'll start to build up in their body, and we need to know if that's happening. Sometimes women will come in like, oh my God, I'm having horrible hot flashes. I need to increase my hormones. But the hot flashes may be because they have too much hormone built up and we need to cut back on their dose, take what we call holidays from the hormones, take a day off here and there kind of thing. So, and then we also want to make sure that estrogen and progesterone are balanced. And the reason why saliva testing is important for that is there's really not a good correlation between topical hormones and blood levels of hormones. And so when you do the saliva testing, it's just a lot more accurate.
What about pellets? Do you have any thoughts on pellets?
I do. We do offer pellets here. There's the demand for it. If we don't do them, they're going to go elsewhere to do them, and I'd rather help manage them, my patients. So, and people can feel superhuman on pellets. Not everybody's a good candidate for pellets. I certainly am not pushy about them. But some people who are just horrible about their compliance with using their creams, or they hate the creams, or they've got the babies all around them and they can't risk transferring creams onto their babies, things like that, where we have to okay, well, let's think about something else. And, pellets got very popular a long time ago because people started doing them and talking about them. And so people will come and say, I want pellets. And so, people who are really sensitive to kind of everything would not recommend doing pellets, just because once those pellets are inserted, they ain't coming out and you're suffering for a few months with those symptoms. So, and there's, different ways to do pellets. You can be super conservative. I've seen people come from other places where they got pellets elsewhere, and I feel like they were really over medicated. And so it's not what we call physiologic dose of a hormone. It's what we call a supratherapeutic dose of hormone when you're getting pellets, and injectable testosterone as well, which we also use. So, you're going to get higher levels than you would if you're trying to achieve a good balance at physiologic dosing with creams.
Yeah, so physiologic meaning what your body would normally be
Yes,
releasing into the system.
exactly.
So, I mean, this is about as anti-aging as it gets when you're talking about hormones. It's one of the top things used to slow the aging process, and not just that, but also make people feel healthy and youthful during their older years. So let's go ahead and stick in the topic of hormones and talk about men and what you're looking for there.
Well, with men, sure, we like to check adrenal hormones as well. So we'll do that for men and women. And, I like to correlate a testosterone level and how the man's doing, how the man's overall health is. I don't like to just treat a number on a test. So, the normal reference range for testosterone is also ridiculously large. So, normal
Right.
reference range for testosterone, like 250 to 900 or 250 to 1100, depends on the lab that you're using. So not everybody needs to be pumped up until they're at the tippy top of the level of testosterone, right? So if a man feels great and their levels in the 600s, and they've got normal blood pressure and they don't really have heart health issues and diabetes and yada yada, and then great. I mean, if they feel fine, their energy's good, libido's great, or erectile function's good, cognition's good, mood's good, then I'm not going to just treat a level that's in the 500s if they don't need it.
Right. Yeah. So you could be anywhere in that range and be normal, but you could also be normal but be low for you, right? And
Yes.
need that replacement. So how do you determine that?
Symptoms. I like to make sure that we're addressing adrenal dysfunction. And also, again, it depends on the man's age. Somebody in their 20s and early 30s is going to be more resilient than somebody who's in his 50s or 60s. So, when the adrenal issues are occurring, it's going to lead to low testosterone. What medications is the man on? Is he on a statin drug for cholesterol? Because that's going to affect your testosterone levels. How toxic are you with all of the toxins out there? That's going to affect the hormone levels as well. So we might start with addressing if somebody's super chronically fatigued. I can tell based on his history of maybe a lot of emotional traumas and working 20 hours a week and things that just scream this guy's doomed for adrenal failure. Then I'm going to work on supporting the adrenal function, and that can help support testosterone to come back into more normal levels, as well as, addressing nutrition issues and detoxification of toxins and things like that.
Right. And getting that exogenous testosterone, which is testosterone from outside the body, I mean, once you're on it, you're kind of on it, right?
Yeah, that's most of the time, that's true. But if you need it, you need it.
Yeah.
So you don't want to live the rest of your life feeling terrible because you have low testosterone, right?
Right.
And it's not that a man couldn't possibly wean. I have been able to wean men back off of testosterone and they did okay. It just has to be an extremely slow wean and to allow the feedback loops to get active again in the body. And so sometimes they need some testosterone support while we're working on adrenals and the whole mind, body, spirit, gut.
Yeah. And also fertility, right?
Mm-hmm.
Can affect
Well,
that.
yeah, testosterone replacement is a good birth control for men. It just kills their sperm production.
Yeah. I mean, there's some ways around that, but
Mhm.
so if you can improve it through your lifestyle, that's fantastic, right? But then if you need it, you really do need it because it changes your whole outlook. Some people are being treated for depression when really all they need is some hormones, right?
Absolutely.
So let's talk about some of the most common labs. At least in my world of allopathic medicine, we do these all the time. They're super common. your regular panel of like a CBC, CMP, lipids, thyroid studies. What are you looking for when you're looking at someone's CBC? What are you checking for?
Yeah, I think in general, these normal routine labs that we do and allopathic doctors do are just number one, a good screening tool. Like, hey, let's
Yeah.
just make sure your kidneys okay and your livers are okay. Kidneys are okay and liver is okay. So same thing with blood counts. When we're checking blood counts, we want to make sure your white blood cell count is not too low and not too high. We want to make sure you're not anemic. If somebody's on testosterone therapy, we want to make sure that their hemoglobin levels don't get too high because testosterone stimulates the production of red blood cells, and that can be dangerous if that gets too high. If somebody's not on testosterone and we see that their hemoglobin level's high, then we have to think about, what else is going on here? It could be that the person's very dehydrated. It could be that they have undiagnosed sleep apnea. And there's also a condition called polycythemia vera. So that can be very helpful. And then we can look at platelet count. So that's an important thing. You want to make sure you're not about to bleed to death if your platelets are too low. But also if your platelets are too high, that can often indicate really bad inflammation in the body.
What do the platelets do for people?
Well, our platelets are responsible for clotting the blood. And so if you've got low platelets and you're not able to clot, you could bleed to death just from nicking yourself while you're shaving.
Yeah, no doubt. And it also gives you like an indication of bone marrow function and you know, a hint into what might be causing anemia in some cases, right?
Hmm.
What does the CMP show?
So CMP, which is Comprehensive Metabolic Panel, it tells us what your blood sugar is. It looks at electrolytes, sodium, potassium, calcium, and etc. And it tells us BUN and creatinine, which are indicators of kidney function. Also, if those are abnormal, it could indicate dehydration. It could be a side effect of a medication that's affecting the kidneys. We look at globulins and proteins. You want to make sure that's not too high or too low. So if your globulins and proteins are low, that could indicate malnutrition, malabsorption. If your protein levels are too high, it could be that you're starting to get a blood disorder or a type of cancer that needs to be looked into. So those basic labs, I just don't understand why anybody would not want to at least do basic
Yeah.
labs once a year.
And liver function as well, definitely.
Yeah,
Shows
the
a lot
AST
about
and
what's going on in
ALT.
the liver.
Yeah, and then there's the alkaline phosphatase that's part of the CMP. And if that's elevated, that can indicate a gallbladder problem or a liver problem or a bone problem. And then you can order what's called isoenzymes that if that alkaline phosphatase is elevated, then it can tell you, the isoenzyme test can tell you, is it elevated because of a bone problem or a liver problem, gallbladder issue. If your alkaline phosphatase is low, that's often an indicator of a deficiency in zinc or B6.
I didn't know that. That's good to know about. Yeah, if the MCV or MCHC are high, it's an indicator of, or if it's of a large red blood cell indicator of a folate or B12 deficiency. Also.
Mm-hmm.
So let's move into like these anemia. We'll come back to thyroid but I think it makes sense to talk about anemia labs like iron, ferritin, B12, TIBC. If you have an indication of an anemia on the CBC, right? CBC is a complete blood count. I don't know if we said that. Then what do these other labs show you? Because it's like you're an investigator, right? You're a detective. You get the clue and then you need to look for the next clue, right?
Mm-hmm. Yes, ma'am. So if we see that somebody's anemic, we got to figure out why. So then you're going to check those labs that you mentioned. And if their iron's low, okay, well, why is your iron level low? Is it low because you're not eating enough iron? Is it low because you're not absorbing that iron? Or is it low because you're bleeding out somewhere, which is usually the GI tract? Or in a menstruating female, it could be that she's just having excessively heavy periods. Or it could be a combination of all the above. B12 deficiency is quite common, especially with vegetarians and vegans, because animal products are a much better source of B12. And yeah, those are probably the most common ones. And with ferritin, which is considered the storage form of iron, well, you're only getting half the picture if all you check is ferritin. And, sometimes I'll just check ferritin because I'm just screening somebody. I'm not expecting to see anemia or an iron problem. It's more just routine stuff. Because insurance companies don't like to cover the cost of vitamins labs. So we try to be judicious about that. But ferritin can also rise with acute inflammation. So your ferritin might look normal even though you're iron deficient. So that's where, you might get only half that picture.
No, that's good information. And then, so you mentioned in the CMP that it gives a blood sugar, and I say it's a snapshot in time, but there's another lab that gives you a better indication, more like I call it a video. What can you tell us a little bit about that lab?
Oh, sure. Are you talking about hemoglobin A1C? Yeah. So the hemoglobin A1C is a routine lab that we do as well. And it's looking at a 3-month video, 3 months picture of what your blood sugar is doing, what it's been averaging. And, that can also be very helpful because your blood sugar may look okay, but your hemoglobin A1C might tell a different story. Or your blood sugar may be high that day, but your hemoglobin A1C may look really good. So, and then there's also now the continuous glucose monitors, which we love to do, where you're wearing these, monitors, patches that people may have seen, that where you're wearing them for a couple of weeks and they sync to an app on your phone and you can see what your blood sugar is doing 24/7. It's fantastic.
Those are so great because talk a little bit about what is happening inside your body when the blood sugar is elevated.
Well, it's inflammatory, it's damaging to your blood vessels and your tissues. And, insulin, when your insulin goes up with that blood sugar problem, it's just exacerbating all of those issues. And if you're not stabilizing your blood sugar, and you're having these swings from high to low for various reasons, that certainly can affect your energy, your brain function, your mood, your hunger centers.
And I've noticed vitamin D has gotten very popular. I used to order a ton of it when I did regular private practice, and then it got harder to get covered by the insurance companies as well. What vitamin D is actually a hormone, but talk a little bit about what that tells you about the patient and what kind of symptoms they have if it's low.
Well, if somebody comes in to see me and they're not taking a vitamin D supplement, then I don't even check a vitamin D level because I already know it's going to be on the low side. We just don't have any good food sources of vitamin D. And even a gallon of milk, not that I recommend drinking a gallon of milk, but if you look at a gallon of milk and it says fortified with vitamin D, well, you'd still have to drink 10 8-ounce glasses a day just to get the RDA of vitamin D. So we really just don't have good food sources unless you like to eat liver and onions every day. And I sure don't. So
And with people being inside all the time and not getting that sunlight where our body can manufacture the vitamin D, that, I live in a very sunny state here in Nevada, but we're all inside or in the shade most of the time. So I lived in Arizona also, and everyone was vitamin D deficient, even though it's a very sunny state.
yeah, that's same story here too. And when people are out in the sun, they're usually wearing sunscreen, or like you said, they're in the shade or long, fully clothed. I'll tell you the only time in 20 years of doing functional medicine that I have ever seen a really good, at the top of normal range level of vitamin D was one of my employees who was addicted to tanning beds. She,
Oh,
that is the only good vitamin D level without supplementing vitamin D that I have ever seen.
that's hilarious. I bet back in the day when people were sunbathing all the time, there probably wasn't nearly as much of a deficiency. And
Mhm.
that's huge in anti-aging. That affects our immune system. It affects all kinds of stuff, right?
Right.
Brain
Vitamin D
function,
is just so important for our immune system and our hormones and
energy level, mitochondria.
mhm.
What other kinds of vitamin tests do you find to be highly useful?
Well, sometimes I'll check a vitamin B6 level. I don't do that too often, but you know, people think of B vitamins who know anything about vitamins typically think of those, oh, well, those are water soluble. Those will be in and out of my body quickly, supplement high doses of vitamin B6 like that. Or they're taking a multivitamin and then they're taking a B complex on top of that. And then they're taking another supplement for some other reason that also has B6 in it, maybe a sleep supplement. And you can get toxic on B6 and it can cause neuropathies, numbness and tingling in the extremities and balance issues because it's affecting your brain too. You can overcome it, thank goodness, if you stop the B6. So, but if anybody out there's suffering with those things, it might be a good idea to check that if you supplement with a lot of B6.
That's
And
a
then
good.
we also do, well, if you want to talk about this later, I like to do a really good nutrient analysis, which is a functional lab that's not covered by insurance, but it tests a whole bunch of different vitamin levels. And so it gives us a lot of good details
Let's
there.
talk about it now. We'll come back to these tests.
Okay. All right. So there's different ways, different types of nutrient analyses. The one that I like to use most is it's called a functional analysis. So the way I explain this to patients is I say, okay, well, what they do is the lab will test substance A and substance B. And we know that substance A converts into substance B, and that will say that requires zinc and magnesium
Okay.
for that conversion to happen. So if the test shows that you've got a lot of substance A and not a lot of substance B, then we can surmise that, oh, well, you're deficient in zinc and or magnesium because you're not converting A over to B to make that level come up. And so that's been a really helpful test. So we will fine tune someone's regimen based on that test with the vitamins they need. Almost everybody is severely deficient in magnesium. That's quite common. CoQ10 is another common one that I see deficiencies, all the B vitamins. Even the fat soluble vitamins, especially, people just eat a really low fat diet. I see it a lot in children when we do that test because it's easy for kids because it's a urine collection. And, if kids are just munching on goldfish and cereal, Cheerios in a bag and just eating kind of low fat diet and high processed foods, then they're not really getting their fat soluble vitamins either.
Yeah, that's a really good point. I never even thought about that. What about lipid panel? What does that tell you, and what do you do about it?
This is something that I have just been trying to scream from the rooftops for 20 years. And, you can go read 100 websites and you'll get 100 different opinions about cholesterol issues. And there are a lot of books out there. And one that I read, 20 years ago that was so eye-opening to me about cholesterol. And, the author talked about how the whole thing started about cholesterol's bad for you when there was this study done, a meta-analysis where they were like, let's try to correlate heart disease with cholesterol levels. And they cherry picked these like 7 countries, said, oh, there's this massive correlation. Okay, well, if you had chosen and cherry picked a different 7 countries, you would have found the complete opposite. That high cholesterol was associated with lower heart problems. And, cholesterol's in our bodies for a reason. It's really important for our nerve health. Our brains are largely made of cholesterol. Every cell membrane in our body has cholesterol in it. Our immune system needs cholesterol. Our hormones, most of our hormones are made from cholesterol. And, getting sunlight, that vitamin D will take cholesterol from the body to make that vitamin D. So that can be helpful for balancing. So if cholesterol is high, it's really a symptom of something. It's not just, okay, we need to lower that cholesterol. And so the analogy I use is, okay, well, your engine light comes on in your car. So you take it into the mechanic, and then you go to pick it up because they call you to say it's ready, and they just put a little Band-Aid on over the red light so you can't see it. That didn't fix the problem, did it?
I love that analogy.
So, yes. And they also, in that book that I read 20 years ago, he talked about how they were also basing it on animal studies, and they were feeding rabbits all this meat. And yeah, their arteries clogged up and they died because they're obligate herbivores. They don't eat meat. So I mean, it's just, yeah.
Oh,
But
that's so funny. I didn't even know that. And lipids are another one where they changed the lab reference rate value.
they sure have over the years. And I might get in trouble for saying this, but it used to be, oh, your cholesterol's okay as long as it's below, what was it, like 260?
300. I think it was 300 at one
Was
point.
it that long ago? So, but I don't remember it that high, but I remember the normal reference range being up to 260. And then it dropped to 240. And then it dropped to 220. And then it dropped to 200. And then I've seen it go down to 180. Some labs still use 200, I think, as the normal reference range. And it's like, and all I can think of is, the lower that they make that top number, the threshold for treatment, the more people now need to be treated with a medication. Who would benefit from that?
Right. Hmm. Interestingly, too, I just learned recently that there are, of course, some people do well with statins and some people have horrible side effects that sometimes don't even go away after you stop the medication. But through the pharmacogenomics, you can get testing to find out how someone's body is going to metabolize that and whether they're going to do well with a statin in the instance that they may need a statin. Of course, it's not going to be covered by insurance, but it does exist. It is available for people that could be a statin candidate if it were the right thing for them at that time.
Yeah, everybody's different, right? There's always more than one way down a mountain, I like to say. And so, if somebody is part of the general population and not part of the wellness or functional medicine population who takes vitamins and eats right and tends to exercise and things like that, if it's somebody from the general population who doesn't take supplements, who doesn't watch anything about their diet, who's not active, the statin drug may be all they have. And yeah, there is some data that shows that, okay, this may be helpful for a certain population. But I'm not a big fan of those medications, and I think their benefit is really overstated a lot of the time. I published an article years ago, and I still feel it's true, that there on Pfizer's own advertisement years ago, it said that their statin drug for cholesterol, decreased heart issues by 36%. Wow, that sounds amazing. And then there was an asterisk. Well, if you scroll down to the bottom of the ad in the little fine print, you find out that it was like, okay, well, 3% had a heart event, cardiovascular event, when they weren't on a statin. and there was a 2% incidence of a cardiovascular event when they were on a statin drug. So while 36% sounds great, it's really your risk went from 3% to 2%, but your risk for probably cancer, Alzheimer's, liver problems, muscle weakness, muscle pain, joint pain, all that stuff went way up taking those medications.
Yeah, that's one of the things we learn in our statistics classes about how these studies are kind of represented in such a way to make it sound like it's a difference without being very meaningful, right? Because from 3% to 2%, that's 33%. But it's not 33% of 100%, it's 33% of 3%. So it's down to just that 1% lower.
Yeah.
So yeah, it's not very meaningful, especially when you compare it to the risks associated with that particular medication, right?
Mhm.
So I know thyroid is such a big one, especially with functional practitioners, because it is not well managed in the allopathic model at all, unfortunately. And functional practitioners are saving people left and right with their thyroid issues. And so I have a special place in my heart for you guys doing that, because I had thyroid cancer and actually had gone to the doctor from my early 20s, complaining of severe fatigue. And they treated me like a mental health patient. At one point, I even had a nurse practitioner palpate my thyroid. This is before I was in the healthcare field at all. And she literally said to me, "Oh, you've got a big Adam's apple there," while I'm in her office complaining of severe fatigue. And not once did my thyroid levels even get checked at all, ever. And I was treated over and over again as being just a drama queen for dragging my butt in there exhausted. And my thyroid problem was only found incidentally when I had injured my back. And don't ask me why, it was a low back injury, but the practitioner I was seeing for workman's comp ordered an MRI of my entire spine. And that includes, of course, the cervical spine. And so the radiology tech popped out of his room and he's like, "Oh, I guess you got some thyroid issues, huh?" And I'm like, "What? No, like, what are you talking about?" He's like, "Oh, no, no, never mind. Never mind. It'll be on the report. I'm not supposed to say anything." And then it ends up that it was not mentioned on the report at all. So I drive back, it's like 30 miles away from my house to the hospital where I had this done. I find that guy and I say, "Do you remember me? Go look." This is years after years of issues with my thyroid, not knowing that it was my thyroid. I track this guy down and he's like, "Yeah, I remember. Didn't he put it on there?" I'm like, "No, it's not on there." So then he finds the radiology tech, has him reread it. Then they mention it. Then I get referred to ENT, who also treated me like I was crazy, but they were nice enough to test me. And my TSH was in the 80s. And they're like, "We've never even seen this before. This is so bad." And so of course I finally got started on thyroid hormone, and then it was several years later that the cancer got diagnosed and all this stuff. But yeah, I look back now being trained in medicine, and I can say that should have been checked on my first visit, that I was complaining of fatigue, along
Mhm.
with whole host of other, constipation and dry skin, and there's several similar symptoms that I was having, fluid retention. Um, But thankfully, there are people like yourself who are really taking thyroid seriously. I try to, but more because of my personal experience, less so because of my training, because there was none other than test the TSH. So I'm going to let you talk about the thyroid panel, because I feel like there are so many people that are not getting diagnosed properly. Maybe they've got some subclinical going on. Tell us how you interpret those labs in relationship to the patient in front of you.
Okay, well, first I'll talk about what does the thyroid do and what would alert you to symptoms of that. So I tell patients, think of your thyroid as your internal engine. It makes things go. So if your engine slows down, think of everything as kind of slowing down. Your energy's lower, your mood is lower, your brain functions slower, your bowels are slower, your temperature runs lower, your pain threshold's lower. And so on the opposite end of that spectrum, if your engine is overactive and you have hyperthyroidism, your nerves are overactive, you might be jittery, your heart's overactive, racing and having palpitations, and your bowels may be overactive, and you may be losing weight because your metabolism is overactive, your temperature may run higher. So when I'm looking at thyroid labs, I'm also correlating that with the patient, because I'm not just going to treat that number. I want to see how the patient's doing. And my favorite labs to run for thyroid, besides checking the antibody levels to look for autoimmune thyroid issues, are TSH. And just in case you don't know out there who's watching, low TSH generally indicates good thyroid function. High TSH generally means low thyroid function. So we look at TSH and we look at free T4 and free T3. This is not the typical thyroid panel that's run by most doctors, because I also like to look at the ratio of your T4, your free T4 and your free T3. And those are the active forms. That's what's getting into the tissues, into your cells to do their job. Thyroid has no action floating around in your blood. So just because you have thyroid hormone in your blood, that doesn't mean it's getting into the cells to do its work. So if your thyroid levels look totally normal, but you're checking off every box of, okay, I'm tired, I'm depressed, I'm constipated, I'm having headaches, my metabolism is slow, I've gained 20 pounds for no reason, etc. I have infertility, I have period problems, and the list goes on, then you likely have a functional problem with your thyroid. It's just that those thyroid hormones can't get into the cells to do their job. And then, so then we start going down the list of, okay, well, what could be doing that? Okay, how are your adrenals functioning? Because that's important. Are your estrogen and progesterone out of balance? Because that can affect how your thyroid works. Are there nutritional deficiencies? You have heavy metal toxicity. So there's a lot of different things that can affect your thyroid at that cellular level. And then, so if I'm looking at the ratios of the free T4 and the free T3, and those are off, meaning usually it's a high T4 and a low T3, it tells us that the T4 is not converting into the T3. And so your T4, we call your reserve form of thyroid. It's not what's most active. It's the active form of thyroid is what makes you feel good, and that's the T3. Unfortunately, most people out there who are taking thyroid medication are taking like levothyroxine, which is T4. And so when you take T4, you're relying on your body's ability to convert that into the active form of T3. And a lot of people can't do that for various reasons. So if you're not, then you're not converting it to T3. Your doctors aren't monitoring T3. So your T4 will keep your TSH where they want it, but that doesn't mean you're going to feel good that way. So a lot of us in functional medicine will like to bypass that problem. Okay, well, let's make sure you're on a combination of T4 and T3, and we'll just bypass that. But if somebody's doing perfectly fine on their T4, and I don't need to change that, I don't have to change that. Another thing that we'll look at is reverse T3. So, and I have to be judicious about testing for it because insurance companies don't like to pay for reverse T3 either. But we look at that as part of the T4, T3 ratio. So I tell patients, T3 is the gas pedal and reverse T3 is the brake. So your T4 and TSH may look fine. Your T3 may look okay too. But generally, I see that the T4 and T3 ratio is not great. you check a reverse T3 because something's not adding up symptom wise, and a reverse T3 is super high. Well, that gives us all the answers we need. It's T4 that converts into reverse T3. So if somebody's taking thyroid and their reverse T3 is too high, it's just drowning out the gas pedal, the T3. So you have to lower the T4 to allow the reverse T3 to come down, or you have to also increase the T3 to drown out the reverse T3. So it can get kind of complicated.
Yeah, and the reverse T3, my understanding, correct me if I'm wrong, is it'll just sit in those receptor sites in the tissues. So then the T3, the free T3 cannot even get into the tissues to be used by the body.
Yeah. So the best thing to do is get that reverse T3 down. And I will usually see that with people who come in and they've been on a high dose of levothyroxine, and they'll say, well, yeah, I don't know why I'm on this high dose and I don't feel well. And my doctor doesn't know what to do because my TSH is already low. And sometimes, patients will go to their doctors and their doctors will say, okay, we'll bump it up a little bit. And so they'll temporarily feel better because they got more thyroid on board, but then it starts converting into more reverse T3 and then they start to feel worse again. And it just becomes a very vicious cycle.
Do you find that you get better results with like Armour thyroid, which is comes from the pig thyroid, than you do from like levothyroxine being a synthetic T4 that they're relying on your body to convert it to T3 for the usable form?
Right. So I like the idea of the natural pig thyroid, but it's for some patients, if they're doing okay on their levothyroxine and we're going to pick our battles and it's super cheap for them, then, we'll use their money elsewhere. And, if there's somebody who's a vegan and doesn't want desiccated thyroid, then we can maybe do levothyroxine and add some commercially available T3 with that. But
Right.
yeah, because the Armour thyroid has T4 and T3 in it, most people love that over the levothyroxine. And we can also compound thyroid any way we want at compounding pharmacies. So we can really fine tune those doses, specific doses of T4 and T3 for people. And regarding Armour thyroid, it's not as clean as it used to be since one of the big pharma people bought it
I
years
didn't
ago.
know that. Tell me more.
Well, it's got gluten in it, I believe. And, wheat is actually a common filler for medications. Often levothyroxine has wheat gluten in it, food dyes, things like that just don't need to be in there. So,
That's an interesting point because this ends up being like people will say, I'm allergic to the generic version, but not the brand name. Usually they're allergic to the filler, not the medication per se.
yeah, exactly.
Yeah.
So, but there's NP thyroid I like. NP thyroid is super clean. It's just that's my favorite desiccated thyroid.
Okay. I'm going to make note of that because I'm not familiar with that one. I did want to share with you an analogy that one of my other speakers on thyroid shared. Her name is Dory Campbell, nurse practitioner. She talks about how you may have a bunch of food in the cupboard, but you're telling your doctor you're starving, but the doctor's looking in the cupboard and saying, but you can't be starving. It's right here. But maybe all you have are cans of food and you don't have a can opener, so you can't get the food into your body. So you're starving, but they're just checking the levels that say it's available to you as opposed to the levels that show that you're consuming it.
Oh, I love that. That's a great
Great.
analogy.
This is a great analogy.
Totally going to steal that.
I know. I use it now with my patients all the time. I love it.
Yeah.
Anything that makes it super simple. And so I know we also wanted to share about CRP. That's such a wealth of information.
Yeah, we definitely monitor CRP levels, C-reactive protein. It's really though, as you know, it's a very non-specific marker for inflammation. And there are different markers for inflammation in the body. We already mentioned platelets can go up, ferritin can go up, Homocysteine levels can indicate inflammation if that's elevated. Um, and, there's SED rate that we will check sometimes, but CRP is very nonspecific. So if CRP comes back really high, we have to think, okay, is this person having a horrible infection right now? Or do they have cancer right now that they don't know about? So that's always a fun conversation to have. Maybe it's a tooth abscess. So when CRP comes back elevated without obvious cause, it's like, okay, now we got to start figuring out why. When's the last time you went to the dentist? Let's go see if you have an abscess tooth you don't know about.
Yeah.
And maybe you have some people have bladder infections with zero symptoms. It's just mind-boggling. So
Or even
let's check that.
strep throat with asymptomatic.
Yeah. So, CRP can be elevated with inflammation, infection, injuries. So I'll ask patients, did you fall and bust your knee the other day by any chance?
What functional medicine labs are you finding that you're ordering most often?
So, well, on blood tests, I do often check homocysteine, uric acid levels. I can tell if people are taking their vitamins usually. I can see how behaved they are with their lifestyle. So homocysteine, we look for optimal levels around 7. And if it's elevated, then we know, okay, well, you probably need more B vitamins or methylation or something like that. And with uric acid, most people connect uric acid with gout. When you have that inflamed joint, if anybody's ever out there has had gout, they know what that means. And so, but uric acid levels we use as a functional medicine test just to monitor, how well is this patient metabolizing food? How good is this person's diet? Are they eating too much processed food with too much, high fructose corn syrup, for example? And they may not even be realizing that they're eating a bunch of high fructose corn syrup. But, uric acid is now highly linked with cognitive issues, high blood pressure, erectile dysfunction, and such. So we definitely like to address that when it comes in. Dr. Perlmutter, are you familiar with him?
No.
Oh, he's great. So he's been a speaker on many summits and conferences I've been to and written books. And I think it's his most recent book is called Drop Acid. It's all about uric acid. It's great.
I'm definitely gonna have to check that out. Is the book as funny as the title?
Yeah, no, I mean he's great. He has a great sense of humor. And other functional labs, like special labs that we do that are not covered by insurance, so they're cash prices for these labs. Sometimes a patient will be willing to do all of them at once, and we'll have all the answers we need all at once. And sometimes we have to roll them out slowly and pick the one that's most important. I'll tell you, probably my favorite initial go-to is food sensitivity testing, because people don't realize what food sensitivities are doing to them. They don't know that they have food sensitivities. And when their test comes back and they have a lot of food sensitivities, it's also a good indicator of how compromised their gut health is. And, so what I like to say to people is people can often connect the dots when they with a true food allergy. So, if you put a peanut in your mouth and your lip swells like that, you're like, oh, I think I'm allergic to peanuts. But with food sensitivities, they're delayed reactions. So you're reacting to something you ate 2 to 3 days earlier, and it's virtually impossible to connect those dots. So this test is really helpful for all those reasons. And while food sensitivities are not going to trigger anaphylactic shock like a true food allergy will, food sensitivities, I like to say, can trigger anything from a skin rash to schizophrenia. And I've seen pretty much all of that over the years. And whether it's occasional symptoms or chronic frequent symptoms that people have because they're eating something that they don't even realize they've become sensitive to. And it can trigger mood disorders and brain fog and skin rashes and joint pain and muscle aches and migraines and other headaches and sinus problems, sinus congestion, stomach issues, allergy symptoms, I mean, bladder issues, heart symptoms. I've just seen it all over the years. It's amazing.
Yeah, it's interesting that you mentioned food sensitivities with schizophrenia. Dr. Andrew Huberman, I'm sure you're probably familiar with him. He's really taken off out there in the podcast space. He had a psychiatrist on named Dr. Chris Palmer, who is getting a lot of traction in treating people with the ketogenic diet. And I can't help but assume that potentially it's really about eliminating those food sensitivities for some of these people that they're having all these reactions to that might be causing the mental health issues.
Absolutely, 100%. And I mean, it's not that somebody can't be allergic to beef or chicken or other meats on the ketogenic diet. You can be allergic to broccoli or sensitive to broccoli. But I mean, the most common culprits are dairy products and wheat and corn, soy, and
Yeah,
eggs.
well, and probably if you're allergic to the meat, then good chance it was a cow that was being raised on that kind of food, right? It's less likely that it was grass-fed if you're having sensitivities to it. So that could be a good elimination diet for the people that need it. Not everybody needs to go through that. So I'm going to put you on the spot here. We didn't discuss this ahead of time. It just popped into my head. I'm really curious if you have some go-to supplements that people, maybe they can't afford a bunch of tests, but you're like, probably you need to be taking these supplements because most people are deficient here. Do you have any of those that you recommend most of the
Yeah,
time?
absolutely. So a good multivitamin covers a lot. And I could spend a few minutes talking about quality of supplements, and you get what you pay for as well. But and why we even need vitamins, because, and number one, like you said, it's lack of food source, and it's the toxins in our environment, our stressors, our emotional stressors, whatever it is that day. It's increasing our body's requirement for nutrients. And so it's just, if anything, it's good insurance to take a multivitamin, a good quality multivitamin. Vitamin D, because multivitamins hardly have any vitamin D in them. So supplementing with vitamin D is important. And we like to use a vitamin D with vitamin K combination pill. And it's important to balance those out because vitamin D is going to make you absorb more calcium. And vitamin K tells that calcium where to go, i.e. go into the bones and not your arteries and joints. So vitamin D definitely, and the multivitamin, it's going to have some B vitamins as well. And so B vitamins are common deficiencies. I mean, who hasn't had stress out there? Stress alone just makes us burn through our B vitamins. So good good multivitamin D. I would say those would be the absolute minimum. If I'm going to do a little more of a well-rounded regimen, I like to add some omega-3s, whether that's a good quality fish oil or krill oil, and a probiotic. And I like to rotate probiotics every now and then. So sometimes we'll use a spore biotic, sometimes we'll use S. boulardii, sometimes we'll use a potent broad spectrum probiotic, and you just kind of rotate them every few months or so. And if that's an alternative to that would be to get sources of fermented foods and learn how to ferment your own food, and fermented vegetables like kimchi. Our nutritionist on staff, she figured out a way to neutralize the flavor of fermented sauerkraut. And you can't use any sauerkraut. Because the stuff that's on the grocery store shelves in the middle aisles is going to be pasteurized. You've killed all the bacteria. It defeats all the purpose, right? So if you make sure you're getting live sauerkraut which means it has all the live cultures, the good bacteria that you're trying to eat, the probiotics. But not everybody likes the flavor of sauerkraut. So if you mix it with a little bit of organic applesauce, it completely neutralizes the flavor. Try it. It's
Oh my
amazing.
gosh,
Oh,
that
try it.
sounds crazy. I'm definitely going to try it.
Yeah. So also digestive enzymes can be helpful. So, that can be an add-on if somebody suffers with any kind of GI problems, um, heartburn, stomach aches, known food sensitivities, food allergies, gas, bloating, irregular bowel movements. Digestive enzymes can be real helpful for that.
What about mag? Do you
Oh,
recommend it
yeah,
for?
I said that earlier that
Yeah.
most people are really deficient in magnesium. Multivitamins will give you some of that, but yes, you're right. I will say that the vast majority of my patients are on magnesium for one reason or another. I'm a huge fan of magnesium. It's involved in so many chemical reactions, hundreds of chemical reactions in the body. And so it helps with so many different things. It can help with depression and anxiety and cognitive issues. It can help you sleep better. It can lower your blood pressure. It can help with asthma and muscle cramps and menstrual cramps. It can help with insulin resistance. It's just the magnesium is the miracle mineral.
Do you choose a certain magnesium based on any gut issues, like if they're constipated versus diarrhea?
I do. So magnesium glycinate, we like to use most of the time if somebody has normal bowel function. It has pretty much the least laxative effect. And then we'll use a magnesium blend sometimes that has a few different types of magnesium chelates for somebody who maybe has a little bit of issue with their regular bowel movements. And if somebody's really constipated, sometimes we'll use a combination of magnesium glycinate and mag citrate and let them just titrate to perfect bowel function. Magnesium citrate has a really good laxative effect, but it also absorbs really well. It's also good for people who have a history of kidney stones.
Oh, I didn't know that.
And yeah, and magnesium oxide is very popular out there. Magnesium oxide is really nothing more than a laxative, which is great if that's what you're looking for. But why not get more bang for your buck and take mag citrate, which also has a good laxative effect, but also you're going to absorb it and get a lot of those internal benefits.
Yeah, that's such good information. Yeah, and also, I mean, you may have already said this, but it sure helps with sleep too, and just like even anxiety. It's smooth muscle relaxer. I remember in the emergency room, we used it a lot for even people who are having respiratory distress so that they could relax and that sort of thing.
Hmm. Yeah.
Okay, well, I mean, this has been phenomenal, wealth of information. Um, I know you've got a free gift for everybody. You want to talk a little bit about that?
Oh, sure. It's just we call it our first steps to dietary cleanup. And it's a little booklet we created, which has some excerpts from my book, Highway to Health. And it's just an easy guide for eat this, not that, and why, and what to look for, what to avoid, and can just help people get off on the right start with how to eat better.
Awesome. And where can people find you?
Well, we are in the Woodlands, Texas area, and our website's twihw.com. And we have a wealth of information on our website too. I've been adding articles and such that I've written for the last 20 years. You could probably find something about anything in our search box on the website.
I think you even have like a GI thing that people can order if they're not even in your state. Is that correct?
Yeah, right. Yeah. So we call it our DIY gut cleanse. And it's a kit that has all the supplements you need and all the instructions you need in the booklet and cookbook and some video modules that you can watch on our website.
I love it. Can they just order that on your website if they go onto the website?
I sure can. Mhm.
Okay, great. Awesome. Thank you so much for joining us. As
Oh, thank you.
Appreciate you.
It was so great to see you again.